Hey, so this video is about what to expect after tonsillectomy surgery. So, unfortunately, tonsillectomy surgery is a relatively painful surgery. There's no way around that. So if you're watching this a few days after I've performed tonsillectomy on you, you may be cursing my name a little bit. So I'm very sorry, but it will get better. So I'd like to give you a few tips and information on things you can do to help ease your recovery and avoid any problems. So the first thing that most people worry about is pain. Their throat hurts a lot after this surgery. What's the best way to minimize that pain? Unfortunately, it's about impossible to completely eliminate pain, but we can usually keep it under control. So for adults, I will typically prescribe a pain medication in liquid form, usually hydrocodone, but depending on patients' allergies, it may be something different. For younger children, we usually use Tylenol and ibuprofen, and we trade off between those every 3 hours. So if your child has Tylenol at 12 o'clock, they would get ibuprofen at 3 o'clock, Tylenol at 6, ibuprofen at 9, so on. And that's usually pretty good at keeping control of the pain. For older children, usually over the age of 6 up through teenage years, we'll also do the Tylenol and ibuprofen, but I'll also prescribe a stronger pain medication just in case. It's usually not going to be necessary for very long, but sometimes it is necessary for a few days after the surgery. So the second thing that people think about is diet. What can you eat safely after tonsillectomy? So as a general rule, my recommendation is you should eat soft foods only for 2 weeks after the surgery. And that's even if your throat's feeling pretty good towards the end of those 2 weeks. Basically, the rule of thumb is if you need to chew it up before you can swallow it, you shouldn't be eating it. So soft foods like pudding or jello, mashed potatoes, chicken noodle soup, all of these are fine. But anything more substantial like potato chips or pizza or sandwiches, you shouldn't be eating that until you're healed. So the things we worry most about after tonsillectomy, the biggest one would be bleeding. So bleeding is relatively uncommon. Bleeding that would actually cause you to come to the emergency room only happens about 1 to 2% of the time. So fortunately, it's rare. It's normal for a day or two after the surgery to maybe notice a little bit of blood mixed in the saliva. But if you do start bleeding, it'll be very obvious. You'll be spitting it out. There'll be clots coming out. So if that happens, normally I recommend gargling with ice water. And frequently that will stop the bleeding right away. Because of the cold in the throat, it'll kind of constrict the blood vessels back there and make it stop. If you do that for several minutes and the bleeding is not slowing down or stopping, that's when you need to either call me or your doctor, if you're not one of my patients, or go to the emergency room. So that's really kind of the main things to look out for after tonsillectomy. Just know that the recovery is not really a very fun process, but once you're recovered, the tonsils don't grow back, and your problem that you had with sore throats or snoring will be much better. So that's the end of this video today, and give us a call if we can help you in the future.